which threatens to end fluoridation. Oh, and I don't know why this, you've seen this, so let me go on. Now, I should warn you, there's another study out there. This was studied under the auspices of the National Toxicology Program. It's an animal study, and they evaluated the neurotoxicity in rats, fluoride in rats. And they declared at the end they couldn't find any. That even though we've previously had over 100 studies from many different research teams from many different countries finding problems. Now, there are several problems with their methodology. They only went up to 20 parts per million, which is not high enough to really scope out the full range. Two, the rats that they were using seem to be less sensitive to fluoride than other rat strains used in other studies. And three, they didn't have a positive control. And what do we mean by that? When you're doing a study like this, it's good to have another set of rats that are given a neurotoxic substance, a known neurotoxic substance. So you give them lead, you give them mercury, and see how your results pan out for a known neurotoxin. And they didn't do that. And why they didn't do that, I don't know. But the whole notion, now the proponents of fluoridation are making such a big thing of this single study. First of all, I say to myself, you know, for years you've dismissed animal studies as not being relevant, the promoters. When we've got such a powerful human study with this Bashash study, it's certainly going to not be knocked out by this single animal study. But I thought you ought to know that. I don't want to be accused of selectively using the literature. That's by McPherson. Okay. So my challenge to fluoridation promoters in Potsdam, if you know any, and you might be here, provide a body of evidence that refutes the evidence I presented that shows fluoride is neurotoxic and has the potential to lower IQ in children, and particularly the Bashash study. Show us what you have. We've got a lot of red flags waving on our side. Where are your green flags? Where? Oh, so we're waiting. And what do you do in the interim? What do you do in the interim? Do you wait for this study to be refuted, or reinforced? What's the word? Confirmed? Reproduced.
Well, there was one, Thomas.
Yeah. Well, the answer is what you should be doing, and what many people believe you should be doing, is to apply the precautionary principle. The precautionary principle says, in a situation where the harm that you're considering is very serious on a population level, and you've got alternatives, you don't wait. Regulatory agencies shouldn't wait until you've had absolute proof of harm before you act. Because in the interim period, many millions of children are going to have, if we're right, will have their IQ lowered or their life shortened, or whatever the situation is. And this is the lesson we learned, incidentally, from things like benzene. For years they suspected that benzene caused leukemia. Finally we proved that it caused leukemia. It was too late for millions of people with that disease who were being exposed to benzene. Now, 10 past 8. What time did I start? I meant to look at my watch.
It was about
7:30. So yeah. Okay, so I've had 40 minutes. I didn't know I was going to get to this point, but I am glad I have. Because we're now turning to some common sense arguments. I don't think we need any more arguments. Okay. I think what I've said is enough. How many people were not convinced by that? Be honest, you're not convinced, or you just have not understood all the details. I was going out too fast, maybe. Give me a rough idea. If you were the decision maker, would you end fluoridation based upon what you heard tonight? Put your hand up. If you were a decision maker. Okay, all right. Yeah, thank you. You've restored my faith in humanity. Yeah. Okay, so some other arguments. using the public water supply to deliver any medicine is a reckless thing to do, and that's what the Mayor and Lynn were talking about. I hope we never again see the use of the public water supply to deliver any medical treatment. In addition to depriving millions of people of their right to informed consent to medicine. You know what this amounts to, Mr. Councillors, that you're here? You are talking about doing to everyone in Potsdam what any doctor in Potsdam could not do to an individual patient. That doctor could not force an individual in Potsdam to drink this water if he thought it was going to do the patient good. If this doctor said to the person who came to the thing, before I talk to you today about your treatment, I want you to drink this glass of water. But doc, don't worry about what's in it. I want you to drink it. It's good for you. But doc, I don't think, drink it. Look, if you don't drink it, don't bother to come back to my office anymore. If that doctor applied any pressure on Bobby here to drink this water against her wish, he or she would lose their license. And yet, whole governments are able to do this. In the case of Ireland, where the whole country has mandatory fluoridation, or some states like Georgia, which have mandatory fluoridation, and some communities which have fluoridation, the government is doing to everyone what a doctor cannot do. And for some people, that is the single most important argument. It was enough to stop many European countries from fluoridating their water, and most countries don't. It's a reckless thing to do. So in addition to being unethical, it's reckless because, what you've heard, it's reckless to expose the whole population to a toxic substance. This takes no account of the fact that some people will be more sensitive than others. When you're exposing everybody back to that normal distribution curve, right? Some people over here will be very robust. They won't be affected by gallons of the stuff. Most people will have an average response, but people over here on this tail end will respond to very small amounts. And those people need protecting. And that is why you never, never put a medicine in the drinking water. Never. Regardless of what good it would do. And you brought that point out. Some people will be harmed. It's reckless to add a known toxic substance to the drinking water with no control over dose. Eloquently mentioned by Lynn and the Mayor. And no control over where it goes to. It goes to the fetus, it goes to bottle-fed infants, it goes to sick people, it goes to people with poor nutrition, it goes to poor people with poor kidney function. Yes, reckless, reckless. No pharmacist should, worth his salt or his credentials, should recommend giving a drug to anybody with no control of dose and no control over who's taking it. And to make matters worse, the fluoride used is not pharmaceutical grade, but a hazardous waste product from the phosphate fertilizer industry with lots of contaminants in it. That's another whole argument which I'm not getting into. 2, we already know that children are being overexposed to fluoride in fluoridated communities. How do we know that? Because of dental fluorosis. Dental fluorosis, these white spots, mottling of the enamel, is the first indication that a child has been damaged by fluoride, overexposed to fluoride. And here are figures from 2010. 28.5% of children 12 to 5 have very mild dental fluorosis. This is up to 25% of the tooth enamel. Usually see it on the cusp of the teeth. 8.6 have mild, which is up to 50% of the tooth surface, and 3.6 have moderate or severe dental fluorosis, where 100% of the tooth enamel is impacted. But altogether, 41%. Why is that significant? Oh, there's mild dental fluorosis, up to 50%. You can see the white patches. I think you can probably see it. Here is the dental fluorosis, these opaque patches. And as the Mayor said, this is a systemic effect. This is not a topical effect. This can only happen to you when the teeth are developing. And that affects 8.6% of American teenagers. Like that. Now, the original promoters of fluoridation thought that they could limit dental fluorosis to 10 to 15% of the population. And that was a trade-off in its very mild form. And in fact, the father of fluoridation, H. Trenley Dean of the US Public Health Service, in testimony in Congress, said that mild dental fluorosis was an unacceptable trade-off for lowering tooth decay. 8.6% would not satisfy Trenley Dean. Not a satisfactory trade-off. Going to... And again, going back to the mayor's comments, what other tissues are being damaged when you see that dental fluorosis? Well, we've talked about the brain and the teeth. What about other tissues? And the National Research Council, they found the following. Fluoride damages bones. So in India, China, when you go to villages, you see the children with dental fluorosis, and you see the adults with skeletal fluorosis. In the most severe form, they're doubled up. They're like this. The whole backbone is frozen. That's severe. But what should concern us is the very first symptoms of skeletal fluorosis is just like the symptoms of arthritis. Stiffness in the joints, aches in the joints, aches in the bones. And on a more physical level, the first symptoms in India, they studied these two bones in the forearm, and if you look at the x-rays, you can see the beginning of deposits between those two bones. That's the first thing you see on x-rays. Fluoride is an endocrine disruptor, according to the National Research Council. Fluoride lowers thyroid function. Fluoride accumulates in the human pineal gland and lowers melatonin production in animals. I think right now the most documented evidence is on the brain, and until that's been resolved, I'm not going to spend too much time on these other issues. Other people are, as they should, but I'm focusing on the brain, and I have for 22 years. The evidence that swallowing fluoride lowers tooth decay is extremely weak. Don't forget where I started off with this talk. The title was, "The risks to the brain outweigh the benefits to the teeth." So let's have a look at the benefits to teeth as they've been able to demonstrate. And I'm not talking now about topical applications. There are good studies which indicate that topical fluoridations of fluoride lower tooth decay. There's good evidence, about 31 double-blind studies, which shows that fluoridated toothpaste lowers tooth decay as compared to other toothpaste. But it's the ingestion that we're talking about here. After 70 years, there's been no individual-based randomized controlled trial for water fluoridation. In other words, they haven't used the standard method that the FDA uses to assess the efficacy of a drug. And what you do is you randomly select a group of kids over here and give them a tablet of fluoride or a glass of water, whatever the dose you're going to choose for the delivery system. And you another randomly selected group of children over here, and you give them a placebo. And then after you do this for a number of years, you show that one has a lot greater, better teeth than the other. Never done it in 70 years. Now, ladies and gentlemen, this isn't my practice. This is the practice of the US Public Health Service. This is the practice of the National Institute of Health, the Department of Health and Human Services. It is their practice. This is something that they're doing to us, the American people, about 200 million people. Don't you think they would have done the most basic test to show that swallowing fluoride actually reduced tooth decay? You would think that, wouldn't you?
You'd hope so.
You would hope so, yeah. Exactly, but they haven't. They haven't done the most basic thing. It's a shocker. Now what we have is we have surveys. So here's the largest survey ever done in the United States. In 86, 87, the US National Institute of Dental Research looked at 39,000 children in 84 communities. And this is the story of two relationships. One is strong and the other is weak. Look at these two relationships. Here they come. Now, these 84,000 children looked at 4 ranges of fluoride concentration they were living with. 0.3, less than 0.3, 0.3 to 0.7, 0.7 to 1.2, that's fluoridation, and greater than 1.2. Now, the first relationship is, do these concentrations relate to the prevalence of dental fluorosis? Oh, yes, it does. Look how, as the fluoride concentration goes up, 0.3 to 1.2, the prevalence of dental fluorosis, 14.6, 19.6, 25.2, 40.5, a very clear relationship. The higher the fluoride, the greater the prevalence of dental fluorosis. Now let's look at the other relationship here. Tooth decay. The percentage of children with caries, 55.5, 54.6, 54.4, 56.4. This practically is practically flat. There's no one is going up, well this way up, and this is flat. No relationship. Or very, very slight. Let's look at it more carefully. This are the actual numbers. In table 6 of the study by Brunel and Carlos, the same data, they looked at decayed, missing and filled surfaces of children who spent all their lives in a fluoridated community compared to children who lived all their lives in a non-fluoridated one. There are about 8,000 kids in each group. Now, for the fluoridated community, decayed, missing and filled surfaces, 2.8. For the non-fluoridated, 3.4. This is the average difference for the whole age range of 5 to 17. Ladies and gentlemen, we're talking about the saving of 0.6 of one tooth surface. You have 4 tooth surfaces in your cutting teeth and 5 surfaces on the chewing teeth. Overall, when they're all out for a kid, it's 128 surfaces. And we're talking about a saving of 0.6 of one surface. This is the reason we fluoridate. I mean, they must build a statue somewhere of a tooth with 0.6 of a patch in platinum. This is incredible. And this is what we're risking our kids' IQ for. Let's go on. This is what David Locker, who's passed away, I debated him before he passed away. He said the magnitude of fluoridation's effect is not large in absolute terms, is often not statistically significant, and may not be of clinical significance. Warren and others. This is the famous Iowa study. This is an amazing study. This has been financed by the US government. Millions of dollars is poured into this study. And the chief guy is a guy called Levy. And they keep publishing this very damaging evidence when you read the paper, but their conclusions never match the damaging evidence that's in the paper. So in this particular case, they examined the relationship between the amount of fluoride ingested by children in milligrams per day and the level of tooth decay. Now this is getting closer to what we want, right? You've got these kids, you measure carefully the number of milligrams per day from their food, from their water, from their toothpaste, and look at their tooth decay. And what was their conclusion? They found no clear relationship. The author said, these findings suggest that achieving a caries-free status may have relatively little to do with fluoride intake. Really? In June 2015, the Cochrane collaboration. Now, the Cochrane collaboration is acknowledged as the gold standard when it comes to systematic reviews. And they looked at the benefits of water fluoridation. And this is what they concluded. They could find no high-quality research that showed that, 1, it provided any benefit to adults, 2, it provided additional benefits over and above topically applied fluoride, 3, no strong evidence that it reduced inequalities among children from different socio-economic groups, one of the big reasons for fluoridation, and 4, tooth decay increased. No high quality evidence showed that tooth decay increased when fluoridation was stopped. Now they did say there was some evidence that fluoridation reduced tooth decay in young children, but they went on to say the team was not convinced that studies showing that water fluoridation reduces tooth decay in children are applicable to today's society, as nearly all the studies reviewed, dating back to the 40s to the 60s, had a high risk of bias and were conducted prior to the availability of fluoride toothpaste and other sources of fluoride which we have today. I don't know about you, but I don't think we've got a lot of strong evidence to suggest that we should be fluoridating water, forgetting the health effects for the moment. But if you bring in the health effects, it gets pretty preposterous. Most countries don't fluoridate their water, but their children's teeth have not suffered. Wow! Let's have a look at that. The vast majority of countries do not fluoridate their water, including 97% of Europe, but their teeth are no worse than those that do. Chris Neurath, our friend and colleague, he plotted from data available for the World Health Organization from the 1960s to the present, the tooth decay rates, the tooth decay in 12-year-olds. And you notice that these tooth decay is coming down as fast in these non-fluoridated countries as the fluoridated ones. And if you look here in the 2000s, it's a wash. There is no difference in the tooth decay in 12-year-olds between the fluoridated and non-fluoridated countries. Let's go on. The probable explanation for the lack of difference in tooth decay is the mechanism of fluoride's action on the teeth. This is what the CDC, should have ended fluoridation in 1999 when the CDC said, laboratory and epidemiologic research suggests that fluoride prevents dental caries predominantly after eruption of the tooth into the mouth, and its actions primarily are topical. It's topical. It works topically. And to state the obvious, if fluoride works primarily on the outside of the tooth, why swallow it? And why put it in the drinking water and force it on people